Good afternoon and welcome to Good Shepherd Healthcare Center's Fall Prevention class. Today we have myself and Corrina Herrera leading the class together. We will be giving you some small tips on falls, concussions, and fall prevention in today's class. Our class, Corrina and I have both taken training to teach this class. I'll let her introduce herself.
I'm Corrina Herrera, the Senior Service Coordinator and Shiva Coordinator for Good Shepherd Hospital.
And I am Sharon Waldern. I am the Care Transition Nurse for the Connections Program at Good Shepherd Hospital. So this program was created through OHSU. It is called Think First Oregon and is a brain and spinal cord injury prevention program. Located at Oregon Health and Sciences University, Think First participates in injury prevention programs and community events throughout the state of Oregon.
The OHSU Think First Oregon mission is to reduce the incidence of brain, spinal cord, and other traumatic injuries and fatalities by providing education to youth, parents, and community members throughout Oregon.
OHSU Think First is associated with Think First Injury Prevention Foundation. There you go. Keep going. There we go.
There's our information.
And we will be showing it at the end so that you can write that down if you would like to. So there's the website to Oregon Think First, http:// or slant, whatever you call that
backwards
thing. Yep, thinkfirst.org. You can tell I'm really a technical computer person. All right, so we're going to talk a little bit about your brain. The cerebrum is the largest part of your brain. It's made up of the right and left hemispheres of the brain, and the right half of the cerebrum controls the left side of the body, and the left half of the cerebrum controls the right side of the body. Our two sides, the two sides of the body the two sides of the brain work together to control the body. Facts about your brain that I find very interesting are the average adult brain weighs about 3.5 pounds. The consistency is actually like soft butter or jello. And your brain, as small as it is, uses 20% of the oxygen and blood in your body. So when you think about the weight, 3.5 pounds, compared to your whole body weight, it uses a lot of the oxygen that we inhale. Water makes up about 75% of the brain, which is why it has that squishy feel to it. And the brain itself does not feel pain. The brain interprets pain signals, and the headaches that we get are often caused by chemical reactions, the muscles in our scalp, and nerves in our neck and head. So what does our brain do for us? Well, here's some examples of what different parts of the brain can do. And this is important because when we talk about a brain injury, depending on where you damage the brain, the effects will vary. So if you keep hitting that. So the frontal lobe, which is in the front of our skull, that is where we make decisions. That's where our emotional control is, problem solving, organizing. That's where we retain our memories, and that's where we do our planning. So the parietal lobe, which is on the sides of the head, that is where we interpret sensory information. That's where we get our signals, our sensation signals for touch and for pain. And the temporal lobe, which is lower down, right kind of on back behind the ears, those are where the centers for hearing, speech, and memory occur. And if you'll notice, there's two areas that are impacted by memory or retain memory, and that's the temporal lobe and the frontal lobe. And the occipital lobe, which is at the back of our head, kind of where that bony bump is, that controls our visual information that we receive and how we perceive it, how we perceive shapes, and that's where we get our color perception. And then the cerebellum, which is still part of the brain but a separate part from the cerebrum, that impacts our balance, our movement, and our coordination. That's where all those senses are controlled. And then there's one more little part to the brain stem. And that controls our breathing, our heart rate, our blood pressure, and swallowing. So, the more complex functions involve parts of the brain that we can see on that diagram, but clearly we use our brain for a lot. In fact, we need our brains for everything we do. There is nothing that you can do that you don't use your brain for. Because the brain is so important, it does have some natural protections built into it. But now we're going to go and talk about concussions. So it's kind of these answers are true or false. So we'll put a statement down. A concussion is a bruise on the brain. True or false? You can answer that at home. The answer is false. The next statement, a concussion is a traumatic brain injury. Again, true or false? The answer is true. Concussions do not show up on MRIs or CAT scans. True or false? The next one. There we go. And it is actually true. And the reason for that, we'll go on and explain that in a little bit, why it does not show up on MRI or CAT scans. Concussions can be caused by a fall, a bump, or a blow to the head or the body. True or false? And the answer is true. Next statement is, concussions usually only happen if a person has been knocked out or lost consciousness. True or false? And the answer is false. Concussion symptoms always show up immediately after the incident. True or false? Concussion symptoms may show up a few days or even weeks after the event. True or false? And that answer is true. So what is a concussion? Simple explanation for concussions is that it is a type of traumatic brain injury, or TBI, which you may hear doctors or nurses use when they're talking about it. It's caused by a bump, blow, or jolt to the head or a hit to the body that causes the head and brain to move rapidly back and forth. A concussion is a disruption to the normal functioning of the brain. It is not a bruise on the brain. In essence, it's not a physical injury that's visible. It's interrupting the electrical signals and the actual functioning of the brain rather than the physical part of the brain. And because it is a disruption to how the brain works, CAT scans and MRI results are normal with concussions. Okay, traumatic brain injury. We'll go on and talk about that a little bit. A concussion is a traumatic brain injury. Traumatic brain injuries are the most common type of brain injury. Falls are the most common cause of traumatic brain injury in the United States. And going back to concussions, they are referred to as a mild traumatic brain injury. But we have learned with research that the word mild does not begin to describe the often life-changing ramifications of having a concussion. All brain injuries are serious, and most brain injuries are preventable. So this is a pie chart that shows us the causes of some of the traumatic brain injuries in the U.S. The data is from 2013 to 2000, I think it's 16, 17. I'm sure there's a newer chart out there. I should have probably tried to find one. But assaults cause 10.7% of brain injuries. Motor vehicle crashes, 4.3%, 14.3%. Being struck by something or striking against something is 15.5%. Unknown causes are 19%, but as you can see, the biggest portion are falls, 40.5%. And this isn't just falls from a great height. This is what we call ground level falls. This is a fall from any height whatsoever. TB, traumatic brain injury related deaths were highest for in the U.S. were highest for persons 75 years of age and older. And related hospitalizations for traumatic brain injury rates were highest among persons 75 years of age and older. So the statistics show that the older we get, the more repercussions there are to having a traumatic brain injury for those of us in that age range. So let's talk about some of the consequences of traumatic brain injury. Decreased neurophysical ability, and that means some people will lose their sense of smell, taste, or vision. It impairs their vision somewhat. Doesn't mean you necessarily go blind, but you may have blurred vision. You may not be able to tolerate light. It does impact that. Speech impairments, and that's often because of where the concussion may occur in the brain. It may impact our ability to speak clearly. We may slur our speech. We may not be able to form the words we want to form. We're thinking of it and it's not coming. It can also cause headaches, can cause extreme fatigue, and it causes loss of balance. And again, most of these are related to where in the brain the concussion has impacted. So cognitive functions can also be affected. We can have memory loss. It's often short-term with a concussion. Sometimes the more severe the injury, the longer the memory loss. It can cause impaired judgment. If you go back to that picture of the brain, the front of the brain was where we controlled our impulses and our thinking. And if you have a concussion in that area of the brain, it is going to impact, or an injury in that area of the brain, it's going to impact the judgments that we make and how we think things through. Also causes difficulty concentrating and completing tasks. And then again, difficulty in communicating. Sometimes we're not hearing things correctly. Again, we're not able to necessarily say what we want to say. And sometimes it can cause seizures. So these are some of the symptoms listed for concussion. And there's 4 major areas of concussion symptoms that I'd like you to remember. And that is our thinking ability and our remembering ability. It impacts us. We have physical symptoms, we have emotional and mood symptoms, and we also have sleep disturbance symptoms. So with the thinking and remembering component, we have difficulty thinking clearly. We often feel like everything's slowed down. Our thought process is slowed down. We feel like our body has slowed down. Things around us don't feel like they're moving fast either. Everything seems slow. We have difficulty concentrating. Very hard to make decisions. Focus on a problem that somebody wants you to solve. Even difficulty focusing on what you want for breakfast and how you're going to make it. And there can be difficulty remembering new information post-concussion. Our physical symptoms can be headache. Some people can have nausea or vomiting, and that's usually early on when they start showing symptoms. Can have balance problems. It's impacting how steady we are on our feet and our ability to control falls when we turn or move quickly. Can feel dizzy. I talked a little bit earlier, fuzzy or blurry vision. That feeling of being tired and not having any energy, and that's a very, very typical common physical symptom for concussions. And then sensitivity to noise or light, as I alluded to earlier. Our emotional symptoms are we can be extremely irritable. We may not realize that. Our families will often pick up on that one. Feeling just sad and just kind of empty and lost. We may be more emotional. We may react much more strongly to stimulation, and we may cry easier, get mad easier, those kinds of things. We may all of a sudden just feel really nervous and anxious and not be able to control that either. Sleep disturbances can go from one extreme to the other. Sleeping more than usual, that's one that seems to be very common. If any of you've had a family member with a concussion, one of the things they always say is make sure you rouse them every couple of hours to make sure that you can get them out of that sleep. Some people have the opposite. They sleep less than usual and they have trouble falling asleep. Of course, that does not help with the emotional mood swings either when that starts occurring. So, how do we recover from concussions? The first thing we need to do when we have hit our head or fallen is we need to tell a friend or a family member. We need to do it when it happens. One of the things the earlier slide said, we may not show symptoms right away. We may not show symptoms for a few days or a week or so later. So if all of a sudden you start feeling off and you've told a family member or a friend and you can't figure out what's going on, they may remember what happened. And so that's the reason you want to do that is if you do go to the doctor, they need to know when that injury occurred. So record it on your calendar when it happens so that, again, as I said earlier, if the symptoms are delayed, you know what they're stemming from. You can give your care provider that information. Contact your doctor when it happens. Let them know that just so it gets in your chart. You may not necessarily feel like you need to go to the doctor at that point, and they may not either, but if it's in your chart when you fell or when you had the injury, they've got it documented. Return to activity gradually. Do not jump back into things. Give your body time to adjust and give your body time to heal. Get plenty of rest. Again, those people who are having trouble sleeping, they're going to need that extra rest, but that fatigue I was talking about, it's one of the signs that your body just wants to rest, and you need to do that. You need to give it that opportunity. You want to avoid physically demanding activities. This means for younger people, if they're involved in extracurricular sports or community sports, they need to not do that for a while. An example is I have a brother who's a football referee. He got hit by one of the younger players. He did end up with a concussion, and he had to stay out of, he couldn't referee for 2 full weeks. He thought he was fine, but his doctor told him he could not do that. So, and he did heal, and he's been fine. The other thing you want to do is limit computer and TV use. And the reason for that is because when you're trying to focus on the computer and on the TV and you've got those lights and the noise, it irritates your brain. Your brain is not able to rest when you're asking it to do those kinds of thinking activities. Okay.
All right, so exercise programs. Anybody at any age could gain strength from exercise. Your program should include endurance, strength, balance, and flexibility. Minimum exercise for people 65 and older. So endurance cardio exercise, 2.5 hours a week or 150 minutes. Oh, what is cardio exercise? Mention body weight, water bottle, can of soup, and resistant band weight training. Falls affect us all, whether personal or
Goes with strength.
oh, okay. Personal or someone we love or care about. Every second, every day, an older adult falls. In 2015 alone, more than 1 in 4 older adults reported falling, and more than 28,000 older adults died as a result of the fall. That's 74 older adults every day. There are simple steps you could take to prevent falls and decrease falls risk. CDC developed a steady Stop Elderly Accidents, Deaths, and Injuries initiative, which includes educational materials and tools to improve fall prevention. Okay, and you could check this program out at https://www.cdc.gov/STEADI/PATient.html. A percentage of those who fall will suffer moderate to severe injuries that make it hard to get around. More than 1/3 of the people 65 and older fall each year. 2/3 of those who fall will fall again within 6 months. Falls are the leading cause of both fatal and non-fatal injuries in people in 65 and older. Most falls are preventable. Falls are not an
inevitable part of aging.
Oh, the cycle of falling. Biological risk factors: mobility problems due to muscle weakness or balance problems, chronic health conditions such as arthritis and stroke, vision changes and vision loss, and lots of sensation in the feet. Environmental risk factors: home and environmental hazards, clutter or lighting, incorrect size, types, or use of assisted devices such as walkers, canes, and crutches, poorly designed public spaces. Behavioral risk factors is inactivity, medication side effects and/or interactions, alcohol use, failure to use assisted devices such as walking stick, cane, walker, or crutches. Another risk factor is osteoporosis. So you can see the healthy bone that's on the left and the bone that has been affected by osteoporosis on the right.
A lot more airspace.
A lot more airspace. Osteoporosis causes bones to become weak and brittle. Osteoporosis occurs when new bone generation doesn't keep up with the removal of old bone. Osteoporosis affects men and women of all races and ethnics. Lower risk to hip fractures. Check with your nurse or doctor before taking any supplements. We need adequate calcium and vitamin D for strong bones. Calcium is 1,200 milligrams a day. Vitamin D is 800 milligrams a day. And weight-bearing exercises and osteoporosis screenings.
And as we get older, most of our providers will want to do bone density testing, which is one of the key osteoporosis screening techniques. Okay, so what happens if we do fall? First thing we want to do is roll onto our side if we are able to, and then crawl over to a chair or a sturdy piece of furniture. Then we want to get our arms up on that chair, and we're in a kneeling position, so that you've got the weight, you can put your body weight on your arms on the chair. Then you bring one knee forward and place that foot flat on the floor and push with your arms and that leg to bring yourself up, and then pivot your body around so that you can then sit down in the chair. You need to stay there and rest before you try to get up to move. It's often kind of a shock to our system when we have that fall. Some people, if they find that they can't roll over onto one side or the other because their hip's too sore, you try this from another angle. Some people may simply not be able to do this. That is when it's important to have a phone close by or a emergency alert system. So, what can we do at home or in general life? So there's 3 options here: exercise, medication review, and vision checks. So with medications, this includes over-the-counter medications and prescription drugs. It also includes any herbals and supplements that you are taking as well. People who take 4 or more medications tend to be at increased risk for falling. And some of that may be because of the interaction between the medications. Many medications can slow our reaction time and impact our ability to react in general, which again increases our risk for falling. When we're talking with our pharmacist and doctor, we can get them to let us know what kind of drug interactions we can expect from the different medications that we're on. Most of them are very willing to do a drug interaction review for you, and oftentimes you'll find your local pharmacist may have more time than your healthcare provider. They are experts on medication. Then the other thing you need to do is talk to your healthcare provider and ask, why are you on each medication? What are they being prescribed for? Is there a way to combine some of the medications so that you're not having to take as many pills? Things like that. You need to advocate for yourself. The other thing is, you can always ask, is there a non-drug approach? Is there something else I can do to help with this condition that I don't need to use medication for? Let's see. If you see multiple doctors, you need to make sure that they are each aware of all the medications that you are taking. Pharmacists went to school for a very long time and are often behind that counter filling the prescriptions. They, again, are a really good resource to talk to about your medications. You want to take, and one of the reasons you want to talk to your doctor and your pharmacist is that some medications can counteract against one another, and some of them may be doing the exact same thing, so you're kind of getting a double dose. You want to take all your prescriptions in to either your pharmacist or your healthcare provider and have them check them. You need to have a current list of all the medications that you are taking and the dosages that you are using written down in case of an emergency. Oftentimes you can ask your pharmacist for a printout of the medications that you're on, or your provider. Again, if you're seeing more than one provider, but you get all of your medications at the same pharmacy, that's the place to go to get your most current updated medication list. Okay, you also want to have your vision checked annually. And I realize that those of us on Medicare, Medicare does not necessarily pay for vision checks. But you need to look around in your community, or again, you could call something like Connections, a service here at Good Shepherd Hospital, to find out if there's a ophthalmologist or optometrist in the area that you can make payments to, or that have reduced costs options for you. We recommend single vision lenses for walking. And the reason for that is when you have progressive lenses, when you're looking forward and then look down quickly, you don't always get you lose your depth perception. And so you're really not sure how deep that curve is, and you can miss a hole, you can miss a rock. So that's why they recommend single vision lenses for walking. And you save your multifocal or progressive lenses for reading and doing things around the house. The next thing you want to do is drink plenty of water. And the reason for that is you can become dehydrated, which increases your risk for falling. And dehydration occurs when you lose more water than you're taking in. And there are many different causes, including some of the medication that you take can make you dehydrated. You don't feel thirsty, so you're not drinking enough liquid, and your body gets used to being in that state of being mildly or moderately dehydrated, and so you don't get the thirst cues that you should be getting. Some people deliberately don't drink much because they have issues with bladder control, and they don't want to have an accident, and they don't like having to get up to the bathroom so often. And many people are on medications that are they're called diuretics, and they cause you to need to go to the bathroom a lot more frequently. So, and then some people just plain just don't drink, they forget to drink water. They just don't think about it. So you want to stay hydrated, and staying hydrated means limiting or completely avoiding caffeinated beverages, as they can dehydrate you. Now, this again means in moderation. Most people can get by with a cup of coffee or a cup of tea in the morning or in the afternoon. That is not going to dehydrate you to the point of severe problem. However, the rest of the day you should be drinking water or something else. You want to carry a water bottle, and you want to use it. And you want that water bottle filled with water, preferably. Not colas, not pops, not sugary drinks. You want water because your body needs that. You want to drink plenty of fluids. And another sign you can look for is if your urine is dark, which means it's either really dark yellow, brownish shade. It can be an indication that you are not drinking enough water. So symptoms of dehydration can be dizziness, headaches, dry mouth or tongue, rapid heart rate or low blood pressure can also be signs of dehydration. And again, not having to decreased urine output. You're just not having to go to the bathroom more than a couple times a day, or a little bit more than that. So those are the things you want to avoid.
So throughout the home, lighting, pathways, wires, and cords, and rugs. So under lighting, brighter bulbs throughout the home is the idea. Pathways, there's no clutter in the paths that you walk, and pick up objects off the floor as soon as you drop them. Wires and cords, coil or tape them close to the wall. And rugs, remove throw rugs, or use double-sided tape, or use non-slip backing. For the bedrooms, night lights, place a lamp close to your bed within easy reach. Put in a night light so you can see where you're walking in the middle of the night, and get up slowly after you sit or lie down to give your eyes and blood pressure time to adjust. So the bathrooms could have non-slip rubber mats, self-stick strips in the tub or shower, could have a bath chair grab bars, and a raised toilet seat. So phones and alarms. Make sure your phone is within reach if you fall. A lot of people carry cell phones around, not necessarily as big as the one in the picture, but something that could easily fit in your pocket. Keep emergency numbers in large print near your phone. Carry a cell phone and keep it charged. Think about wearing an alarm device in case you fall and you can't get up. Have people regularly check on you. And consider carrying a whistle for you to blow if you fall so your neighbors or
somebody can hear you.
Yes.
Hey, another thing we can do to help reduce falls is think about our footwear and what we're putting on our feet. So what we want to do is avoid smooth leather or plastic soles. In other words, they don't have anything that causes friction, so it's really easy to slip and slide in those. We also want to avoid slip-on shoes and flip-flops. That includes slippers. They are slip-ons, most of them. If you've got slippers that have a nice firm sole and they go around the back of your heel, those are, and give you good support, those are fine.
Rubber bottoms.
Yeah. You don't want to have wear high or narrow heeled shoes. Those do increase the risk of falling. And loose, stretched out shoes, you know, the ones that we all have that are super, super comfortable, and we just kind of slop around in them because they feel great. Those really increase our risk for falling as well. We do want to make sure that our shoes are allowing circulation in our feet. We do not want them to be too tight. They should fit snugly. But we should not have spots where when we take our shoes off, we have red marks, or we have friction burns on the back of our heel or the ends of our toes, something like that. Our shoes should have low or flat heels, and the sole should provide good traction. So we want our walking shoes, when you go to get a walking shoe, you want it to have good traction and support, but the sole should not be really heavy. The rule of thumb with shoes is you should not be able to bend your shoe. The shoe should have good traction and support, and again, as I said, the sole should not be too heavy. Shoes with too much traction, because there are some out there that have these little suction cups on them, can actually be bad for someone who's at risk for falling. We can use hiking poles when we're out walking. That helps maintain good body posture. It also helps prevent falls. So think about the shoes you currently like to wear when you're walking or around the house, and think about, do I need to replace these or am I good to go? So this is the end of our discussion today. We do have a slide up here with some other resources that are available to you. There is the National Institute on Aging. The website here, that's their website there. There are some exercise videos that you can get on. You want to look for things that say, you can look up under matter of balance. There are other exercise videos out there under the National Institute on Aging that are good for maintaining balance and building up our core and helping us build up our strength. You can also make sure if you've got concerns about your medications, there are websites you can go to, but again, your pharmacist is your best bet. And the Center for Disease Control's STEADY program has a lot of information on fall prevention, things you can do at home, things to make your home safer. And again, here is Corrina and my information if you would like to write it down. And I hope you've enjoyed today's talk, and we look forward to seeing you in one of our Matter of Balance classes. Thank you so much.